Hey guys, Dr. Gary here, City Facial Plastics. So today we're doing platelet-rich plasma for the scalp. So when there's hair loss, there are invasive techniques such as hair transplant surgery that can restore the hair, but there's also non-invasive things like PRP injections for the scalp. So that's what we're doing today. Got an amazing patient here.
Hi, my name is Sai. I'm 26 years old. I've been losing hair a lot. It was 5 months ago. I've been noticing a lot, and I figured I don't want a hair transplant right away because it might be progressing a lot in the future. So I figured PRP is the best treatment, and this is my fifth treatment with Gary. It's been amazing. I've been seeing results, and I'm not using any medication. Just PRP alone is giving me results, so I'm kind of happy with it. I'm gonna finish this fifth treatment and kind of try to repeat it every 6 months to maintain until I hit 30, and maybe if I have a lot of hair, then I'm happy.
What we've done here is we've extracted 60 cc's of blood, so just a regular blood draw, and this is actually just water. It's used to balance out the blood in the centrifuge. The centrifuge is from M-Site. They make one of the best systems on the market right now. You get the most number of platelets from their system compared to all the others on the market. So what we have here is red blood cells, and then we have plasma and platelets up in here. And so we don't need all this red blood cell. That's not what we're going to be injecting into the scalp. We need to extract the platelets out from this yellow mixture. So you'll see we'll do another spin in the centrifuge, and you'll see what happens to this yellow product. So now I am extracting the platelet-rich plasma into this other syringe, and I'm leaving all that heavy red blood cell stuff behind. And you can see it right there. There'll come a point where the red stuff starts to come up faster, and that's where we seal it off, right there. So we've now treated this entire area here, the mid-scalp, the parietal scalp, and the crown area. Now we're gonna focus in on this frontal scalp area. You can see here I'm going in and really watching for these blebs that are forming, making sure things don't leak too much, and really treating this frontal region as much as we can here. Doing okay?
Mm-hmm.
And that's how we do PRP for the scalp. And then this area gets cleaned up. I also do a little bit of micro needling with an even smaller needle at the end. And then we clean it up, and he walks out of here looking fully normal. Just a little bit of redness that will go away in a few hours. And then, Sai, what would you say about recovery, like the next day or later?
I don't feel anything at all. I feel completely normal. Even right after the treatment, other than the red spots on my head, it's completely normal for me.
The next day is okay?
Yeah, I go to gym tomorrow.
Yeah, great. Excellent. Thanks for joining, guys. And if you have any questions, feel free to contact the office.